Can everybody see the screen? Great. Okay. Well, we're going to go ahead and get started because it is about 9:06, and we will welcome other people as they come on board for the meeting today. So thanks everybody for being here and for your flexibility around changing our meetings. Both Lori and I had a kind of a family emergency for both of us, and we are back now. So I thought we would first start here. We've got an agenda that's pretty packed. We're going to do a partner spotlight. That's Child Care Aware of Kansas. And then we are going to talk a little bit about the review of our meeting purpose. We're going to reflect a little bit about the work that we've done with the Kcpa plan. And then we are going to do some resource sharing. And then anything else anybody would like to talk about. So here is our icebreaker, and this is from my co-chair, Lori, which she's not on today, I don't believe. So this time of year, we see squirrels packing away nuts for the winter. What is your life comparison? Describe what you do to collect or save that might compare you to a squirrel. So if we could go around and just do quick introductions, your name, where you're from, and then answer the icebreaker, that would be great. Who wants to go first? I can't see everybody's faces.
I'll go first.
Okay, thanks, Veronica.
Hi, everyone. My name's Veronica. I'm actually a Vista. I'm through AmeriCorps, and I just started working in the weighing in program. So I'll be working partly with the Children's Mercy Garden, and I'll also be working with other activities related to the physical activity plan and other weighing in activities. I think I would say my comparison would be sweet potatoes. I collect sweet potatoes and then I have them for all winter.
Nice.
Yeah.
That's a good choice. Better than a candy bar.
Yep.
Denise, do you want to go next? It's kind of going in order here.
Yeah, I'm sitting here going, what would that even be? So
Okay.
Denise Sullivan, University of Missouri Extension. I'm a nutrition and health education field specialist serving Jackson and Platte County. And boy, I don't know. I mean, I'm trying to think, what am I stashing away other than just clutter, which in my house, which I'm actually trying to clear, right? You know, I'm trying to do the reverse thing. So cleaning out closets and corners where things accumulate. So it's kind of a reverse squirrel approach.
That's okay. Welcome, Denise. Shelley, you want to introduce yourself?
Sure. I'm Shelley Summer. I manage the weighing in program at Children's Mercy, and I'm here trying to provide technical support this morning, and I'm not very good at it. So I've been a little bit distracted, which is why I didn't just jump on first and do an introduction. So sorry about that. And because of that distraction, I don't even have an answer about that.
That's okay.
Icebreaker. So I'm just happy to be here.
Yep.
And I'll turn it over to, how about Kyle?
Perfect.
Good morning, everyone. My name is Kyle Matchell. I am a program manager with the Mid-America Regional Council's Early Learning Department. Oh, and gosh, what do I collect? Well, I've been ordering reading glasses off of Amazon for like $6 for a half dozen, and then I kind of collect those and sprinkle them around the house, so I always have one handy.
Yeah.
And then they always seem to wind up in my car, so that's the closest thing I have.
Oh, good to see you, Kyle. I can so relate to that. Kyle, do you want to throw it to somebody?
Oh, I'm trying to see. I'm not sure who else has already gone. Is Lori gone?
No.
Lori.
All right, good morning, everybody. Yes, hi, my name is Lori Wellner, and I'm with, try to get my K-State Research and Extension in Wyandotte County. My areas of, I guess, target or expertise, nutrition, wellness, and food safety. And kind of like Denise, I'm sort of the opposite. I was thinking about stockpiling, I guess, more or less just cold winter task to take on. So we started painting doors, and that's a horrible thing to do, but necessary. So I'm ready to get that over and move on. Anyway,
Excellent.
thanks for inviting me. And I guess, let's see, how about Sarah?
Perfect.
Sarah? Yeah.
Good morning, ladies and gentlemen. Thank you for inviting me. Thanks for pushing me next, Miss Lori. I was just thinking I'm going to call you because I need to update some food safety certifications. Anyway, my name is Sarah Eber. I am the Human Nutrition and Health Program Coordinator at Lincoln University Cooperative Extension. I'm based out of Jefferson City, but I work with our outreach centers in Kansas City, which I think my Tina Worth is really involved with a lot of the gardens there. And then we also have outreach sites in St. Louis and the Boot Heel, and now some coming up in Southwest Missouri. And it's interesting that you mentioned about the squirrel, because I was just thinking this morning that I really needed to go raid my neighbor's yard, because he has a bunch of persimmon trees, and I really need to go now that it's frosted. I have a tendency to cook off all those pumpkins sitting around the house and put away the pumpkin puree for the year, and mill the persimmons and get the seeds out and freeze persimmons so I can make cookies and persimmon pudding and muffins for the year.
Nice.
That's my squirrel activity.
That's a good one. Do you want to throw it to somebody?
Oh, I'm going to throw it to Jill Luce, just because I don't think she's talked yet, right?
Yep. Jill, are you there?
Can you hear me now?
Yes,
I
we
can hear you
can.
now.
Okay, great. We're kind of off kilter today. Our building was closed today because of the power outage. And so I'm trying to get everything fixed up at home. I didn't bring my computer home last night. And
Sure.
so I'm like a squirrel right now. I'm not gathering anything, but I am running around with my head cut off, I think. But I am with Olathe Head Start, and I am the community development specialist. And so I'm just now getting my feet wet on what all is going on around the community, and figuring out where I can be helpful and how I can help our program and other programs.
Hey, welcome, Jill. Glad to have you here.
Thank you. Glad to be here.
Do you want to toss it to somebody?
Okay. Has Evelyn spoken yet?
No.
I can go next. I'm Evelyn. I am part of Children's Mercy. I work with Shelly and her team in the waiting in. I also provide support. I was having issues with Zoom earlier, so but yeah, I think something that I probably accumulate like a little squirrel or candy, just because the holidays are coming up, and just snacks and things like that.
Yeah. Who do you want to toss it to? I think there's a couple people left. Haley and Candace.
Candace.
Good morning, ladies. How are you today?
Good morning.
Oh, what do I gather like a little squirrel? It looks like, and that's why I have my background filtered, so you can't see all the paper. paper. So I would say today paper. I'm Candace Cheatham with the Kansas City Public Schools. I have parents as teachers, Success by 6, and supportive care. And thank you all for what you all do here on this committee. I've gleaned a lot.
Great. Good to have you again, Candace. like we've got Haley and Heather.
My name is Haley. I'm with Kansas City University here in Kansas City, Missouri. I'm a health and wellness coordinator here. My life has been a little bit consumed with COVID right now, but once hopefully we get a handle of COVID, then we can really focus back on to our wellness initiatives here on our campus. But especially with the 5 to 12-year-olds being able to get vaccinated now, that's kind of where we're doing, and we're helping support our community. We do have a great, phenomenal program called Score One or CHAMP program, where we work with local schools and elementary students to develop health and wellness programs, physical activities. And so we also go out and do dental screenings, eye screenings. So we do a variety of different health and wellness initiatives. So I'm very happy to be here to learn from all you guys, and then maybe even partner up on any efforts that we can work together on. So I'm happy to be here, and I love blankets. So I travel and I love to go all over the place. And the last place I was just at was Ireland, and I got this really cool wool blanket. So I have so many blankets. Probably need to donate some of them back to the community, but I love blankets.
That's awesome. Thanks, Haley. And we will transition over to Heather. Do you want to introduce yourself? And then I will throw it back to you.
Yes, ma'am. So my name is Heather. I'm the program manager for the Child Care Health Consultant Network with Child Care Aware of Kansas. That's a tongue twister if you try to say it really fast. But I would say what I'm collecting right now like a squirrel as I'm gearing up for winter is my hot beverages. So coffee, tea, hot chocolates. I got a new coffee pot this past weekend, and I feel like I'm drinking coffee for the first time because mine was like 15 plus years old and it was starting not to work so nice with me. But now it's like, oh my gosh, this is what coffee's supposed to taste like. So I am thoroughly enjoying it and probably going a little bit crazy with coffee right now. So, but it's okay. You know,
That's
just
awesome.
a mild addiction.
Welcome, Heather.
And that explains the endless smiles over there.
Yeah. Well, I got like 3 different cups over here right now, and you know.
I want to make sure I didn't miss anyone or anybody that jumped on, but I think we're good. Before we do our partner spotlight, I'll just quickly introduce myself because I think I forgot to do that. I'm Rhonda Erpelding, and I am the co-lead of this group with Lori Lanter from the UG. And I'm also the sector lead for the Early Childhood KC Physical Activity Plan. And in my daytime job, I am a program manager at Harvesters. I oversee the back snack and school pantry programs. So we are excited today to have a partner spotlight. Heather is an old colleague of mine, and it's great to have her today. So I am going to hand it over to her, and I wanted to ask Heather, did you have any screens to share and I can stop sharing?
Nope, we're good. I was just going to kind of give our little spiel and everything.
That sounds great.
So I'm a very laid back person, everyone. So if anybody has a question as I'm talking, just, you know, beep me, honk at me, whatever you got to do. And I will answer to the best of my abilities. I am still transitioning into this new role. I haven't been the program manager for very long, less than a month, but I've been with this network for over a year. So I have truly been with it from the beginning. But what the Child Care Health Consultant Network does, in a nutshell, is we are a free, customizable consultation service that helps child care providers focus on health, safety, and wellness in their programs. Health, safety, and wellness is a very broad topic. There's not a lot, if you think about it, that happens in a child care program that doesn't fit into one of those 3 categories. But that is our focus. We actually birth was given to us because of COVID-19. So there's a silver lining to COVID-19, but it was really the need was identified in 2020 that child care providers need support in these areas. They've always needed it, but now they need it more than ever because they're trying to navigate, everything of the busy life of childcare providers. On top of now, they're trying to incorporate, increased health and safety stuff to help protect them, their families, their staffs, from this pandemic that we are, currently navigating. So some of the things that we have done with providers that fall under health, safety, and wellness is, we've helped them implement developmental milestone checklists so that they can check in on the kiddos that they are observing. We've done playground safety checklists, room arrangements, checking the daily schedule. Of course, all of the stuff you could think about COVID-19, we definitely have a focus on that as well. So helping them understand how to do health checks, how do they handle situations, like if they have a positive exposure in their program, how do they handle it? Kind of like the before, during, and the aftermath of it all. So that is a really focused. Policies are a big focus of us as well. But you name it, chances are we can probably make it fit into the health, safety, and wellness side of the childcare programs. But we really are, we have a self-assessment that providers utilize that can kind of help get the ball rolling. And it can kind of help them identify what needs they may have in their program that they don't know that they may have in their program, whether that's emergency preparedness, health equity, we also have oral health as one of our competencies as well, child abuse and neglect, a whole bunch of different things. But that self-assessment really helps the providers kind of hone in on what they didn't realize they could improve on, or maybe something that they already knew they wanted to, and now they really want to work on it. So we do that with them. And then of course we have goal settings and we help them implement it and all that kind of stuff. We do not serve as a surveyor or a licensor in any way, shape, or form. We are a partner with them. I like to call us the legs. We do all the leg work for the provider. So if it's, researching something, or maybe even helping them do a rough draft of a policy they want to come up with, we really are their legs. They are the driver, we are the passenger, but we really are that partner and that coach and everything like that. And that's what we've been doing for about the past 6 months or so, is really focusing on the health and safety stuff. But now we are growing and expanding even more. So we are super excited to share that coming in the very near future, and I mean so close that I can almost put my fingers together, near future. We, again, 2020 taught us a lot, right? We also learned how much of a childcare shortage there is in this country, but, and in Kansas, obviously as well. So we are now working with helping to recruit providers to come into this field. So people that maybe didn't necessarily know that they wanted to be a childcare provider, or maybe they knew they've always wanted to, but they have no idea where to even get started. We are now bringing consultants on board that are going to solely help with the startup. So helping providers, get through the process, helping them break down barriers that they might have with getting licensed, from switching from a temporary to a permanent license. So that is going to be a focus as well. So that's new and coming. And I mean, coming we're building it as we're flying it already. Rhonda's been there with us, so she understands that. But that we're super excited for that. And then the other thing that we are adding is we are building on what we've already been doing, and we're adding some specialty focuses. So we are actually bringing on a registered nurse onto the team. We're actually bringing 2 of them onto the team to really help with the medical side of ECE. And there's, again, COVID taught us that there's a lot out there that the nurse can support, but there's a lot there in childcare programs that nurses can support, like immunizations, just control all the other illnesses that can happen in childcare, right? Pink eye, lice. I shouldn't have said lice because now we're all going to start scratching our heads. But we're bringing on 2 nurses as well, registered nurses, and they're going to keep those qualifications as well so that they can provide that mentorship to providers as well. And we're also going to focus on overall emergency preparedness. Again, it ties back to 2020, and we learned how much providers didn't know that they needed to be prepared for something like this, and because none of us were anticipating a pandemic, in our lives. So we really are bringing on, we're bringing on a consultant that their focus is going to be, emergency preparedness, but not just the pandemic side, making sure fire and tornado and heaven forbid, like an active shooter and all the other emergencies that could happen in a childcare center. We're going to bring on somebody that can truly focus on helping them establish those policies and practices. So heaven forbid, if they ever have to use them, they will be prepared. And then we're also going to be bringing on a consultant that helps from the health equity perspective. We really want to make sure that providers know how to have a culturally responsive program, and so that it's accessible to all, that all feel welcome to come to their program as well. So that's going to be a specialty focus that we're going to have as well. And all of those, the nurse, the emergency preparedness, and the health equity are part of our self-assessment. So providers may not know they have a need, but then once they take it, they'll be like, oh, I didn't even think that I needed this in my program. So, but that really is us in a nutshell, what we are doing and where we are going with it. But I'll just pause for a minute and see if anybody has questions or comments, or I'm an open book. I'll do my best to answer it.
Well, I appreciate all that Child Care Aware has done in supporting. We met last night Tuesday night at a child care center on just the data and the resources, and would like to find out how we can maybe partner better, because I also do supportive care, which supports child care providers in our community.
Definitely. Love to. I'm all for it. More relationships, the better.
Heather, I have a question for you.
Yes.
Are you guys using any of the knapsack assessments?
So we, not on childcare, not on the CCHC side, but some of our other program quality initiatives are using the knapsacks.
Okay.
I believe CCQI primarily uses it. And I think even Links to Quality ties in a portion of it as well into their self-assessment.
Perfect. Okay. I have a couple more questions.
Hey, hit me, girl.
Heather, how many childcare health consultants are on staff?
So right now we are very rapidly expanding. So our team right now has 7. But we are adding 10 new positions. So we are going to be close to 20 when this is said and done. So interviews are happening left and right. So we're small now, but in a matter of weeks, we are going to be in the double digits. So it's super exciting, super exciting.
Absolutely, it is. You guys have really grew a robust program.
Yeah.
It's exciting.
Fast paced, but I love it.
As a follow-up to that question, Heather, do you know how many are focused in the Kansas City region?
So right now we are not hiring specifically in by regions. We do have consultants, and we have 2 consultants right now that are located in the Northeast, but the ones that we are bringing on board, we're not necessarily looking to hire in specific regions because our network is a statewide thing. So everything that we offer, it's not going to matter where the provider is located at. We're going to be able to give the service to them regardless of their location. So we do have a couple that are stationed there, and we do try our best to pair providers with the consultants that are in their region. And we have every corner, I shouldn't say every corner of Kansas because there's a lot of corners in Kansas, but we are completely spread across the state in Kansas, and I would like to say we have somebody at least in every region. But what we do is, regardless of who they're paired up with, we make sure that our stuff is a statewide thing so that if it is somebody in a certain region, they have access to it just as if somebody's in a city or in the country. We try to get that.
Great.
Wonderful.
And how many programs to date, Heather, has Childcare Aware been supporting? Do you have
So since our relaunch, which was like May timeframe, which is really when we started doing the our one-on-one consultations, and we moved away from the grant, we have, off the top of my head, I believe it has been close to 350 programs that we have had consultation services with. And the beauty of our network is we are truly customizable. So however they want to work with us, we are going to work with them that way. Whether they want to do the self-assessment, or if they're like, you know what, I don't want to do the self-assessment, but I've always wanted to do this. Can you just help me do it? We can skip past things. It truly is a customizable program. And I think that's why we've been able to reach the amount that we have, because some can take on a little bit more, and then a program that maybe is short staffed, they can't take on as much right now. So they just need a different kind of approach. So, but yeah, to date, we've had over 350 that have come through our doors and met with us one-on-one.
That is great. Anybody else? Any last questions for Heather? I guess in closing, Heather, I would just ask, how does a program get in contact with your staff?
Yep. So we have, of course, you're more than welcome to call the Child Care Aware of Kansas office, and Miss Tracy can put you through to us. But honestly, the best way to probably get in touch with us is through our team email. And our email, I can put it in the chat so everybody can see it. But Miss Louisa, she's our program assistant. She monitors that thing pretty much 24/7. So if you ever want to, reach out, partner with us, brainstorm. If you know a provider that could, benefit from our services, you're more than welcome to do that as well. But I will put our contact information in the chat for everybody.
That would be great. Well, if we don't have any other questions, I just want to say thank you, Heather, so much for your time today. You guys are doing wonderful work to help support the early care and education programs across the state of Kansas. And it's great to know that there are great, strong supports that are out there for providers. And man, you guys have really grown your program, and that is so exciting. So keep up the great work. And Heather, you're welcome to stay on the meeting or jump off if you have something else to do. But thank you again for your time and for being our partner spotlight today.
Yeah, thank you so much. I appreciate it.
Heather?
Yes, ma'am.
Before you jump off, it looks like there might be a question in the chat.
Oh, okay.
Asking if you support school programs.
So like before and after school, I would assume is what you're referring. Yes. So yes, we do. Any licensed program in the state of Kansas, so that's family, child, before and after, Head Start, preschool, we work with all of them.
Great question.
Yeah, that's good information. Thanks for sharing that. My one last thing before you go, so sorry I didn't jump in before this, but I was just thinking about advocacy and the strategies of the Early Childhood Working Group. And from a statewide perspective in Kansas, are there things that your organization is currently advocating for? Or are you able to do that? Or are there things you'd recommend?
So for our network specifically, yes, we do advocate, but really that goes above us. So Kelly, she's our executive director at Child Care Aware Kansas. So whatever needs that we find or are hearing are out there, you know, from the child care providers, we really do take it to her. And Kelly truly is our advocate. She is the one that's like, okay, I've heard this is the need. And then she goes out there and tries to find how to get those needs met within not just the child care communities, but the families as well, because that is a focus of Child Care Aware of Kansas. So at our level, we are more for, just seeing what the need is and then passing it along still within Child Care Aware Kansas. And then they really do focus on advocating for us, whether it means we need to look at getting funds into providers or additional resources or supplies or materials, whatever could be. But that is a part of Child Care Aware Kansas. Yes.
Okay, great question.
Thank you.
Okay. Well, thanks again, Heather. I appreciate it.
Thank you.
All right, we'll move on to our next. I thought it would be important just for us because we do have quite a few, should I say, new faces on the call, which we're glad to have new people joining our group. Is just to do a quick review and reflection around the Kcpa plan. So just kind of do high level overview for you. So the Kcpa plan has identified 4 different strategies that we are focusing on. And so you can see here, we'll go a little bit further in detail. But strategy 4 talks about state and regional partners should adopt standards for early childhood education settings to ensure that children are appropriately physically active. And so you can see we have some of our priorities listed below. So strategy 5 is that state and regional partners should provide professional development to ensure effective implementation of physical activity standards and best practices. And we've got our 3 priorities listed. Strategy 6 is that state and regional partners should share and promote high priority best practices for physical activity in ECE. And we've got 3 priorities underneath that as well. And then our last strategy is that early childhood providers should include physical activity resources and opportunities within family engagement efforts at the regional or program levels. So I thought just kind of doing an overview today and talking a little bit about just the work that we've done so far when we think about our Kcpa plan. And so when you look at the piece of the puzzle, should you say, or piece of the pie, you can see that we identified within our 4 areas that we have focused on standards, training, best practices, and family engagement. So keeping those 4 strategies in mind, I thought what we could do is just kind of open up and talk a little bit about, what is some of the progress that we have made collectively as a group when we think about those 4 strategy areas. So I'll just kind of open it up and we can talk a little bit about just our progress. And I think that will help to direct us where we are looking to go. And I may kick it off a little bit to help remind everybody. But oh my gosh, it's been a while. Several months ago, we got together a group of directors looking at all different types of programs, so group, home, as well as center-based. And we had 9 that were involved, and we met with them 3 different times to really dive into the strategies and the priority areas that we had identified as a larger group, so that they could direct us on, what are some low-hanging fruit priorities that we were able to grab and go with? What are more of a larger program or a larger priority that will take more time? And what really resonated out of meeting with the directors for these 3 times is that training was really important to them, and that they wanted to see in our regional area how training around physical activity could be integrated into quality initiatives, and also into just any training that is provided for early childhood. So we've had some conversations around for example, with even Lori Lanter from the UG about when new programs come on board, making sure that, we talk a little bit about the importance of physical activity with young children. And so that is one thing that I would say that has gone really well, and that's been some great progress. Is there anything else? I've got a couple other, but I wanted to just kind of open it up if anyone else had an opportunity to share about some progress that we've made.
I would be inclined to say just exposure, just exposing people to, because change comes about by knowing comes, then action can come. So I do believe that we have exposed people to the prioritizing it, and then to even know that there are resources that exist that can support.
That's great, Candace. Thank you for sharing that. Absolutely. That is such an important piece to be able to get some traction, is just the exposure. Yeah, getting people to know that there is a KCPA plan. Anyone else? I know something else that I would add is, and I believe it was sent out to the larger group, but the Missouri Department of Health and Human Services, under Lisa Farmer, they did secure a date of December 4th with Dr. Kraft, which is a free 2-hour training from 8:30 to 10:30. There is a electronic flyer that is going around for providers to sign up. Has everybody seen that? Yes, no, maybe. Kyle, have you seen it?
I can't recall. Can be forwarded back out to folks?
Absolutely, it sure can.
We sent that out in the newsletter with the meeting registration and all of that.
Thank you, Evelyn. Okay, yeah, we can definitely, when we send out our notes, we can do that as well. And Kyle, I'll make sure that you get that. I will just do a quick reminder, not a reminder, but just a little bit of the tip. When you click on the link to register, it's going to ask for a MOPE ID, which is the Missouri Professional Development. For Kansas providers, you can just type in a bunch of zeros, something. That was one of the caveats that we discovered early on. Childcare providers in Kansas didn't know what to do, which is a great question, because I wouldn't have either. So they're just supposed to put some zeros in if they're not on the Missouri side. Anything else?
Rhonda, I think do I recall, is the activity plan, is there some data that's collected? Is there going to be like a report every other year or something with regards to our progress?
That is a great question. I'm going to throw that, Shelley, have we discussed that as a larger group?
Kyle, thanks for asking that. There are a few things that we're doing with the Kansas City Physical Activity Plan. For those of you who may not be aware, we did publish a regional report card on physical activity for children and youth. That report card is modeled after the national report card, but is reported based on local data. So there were 9 indicators that the national report card looked at. In our local report card, we've given grades as well as data quality grades related to those 9 indicators to sort of show how we're doing in the Kansas City area. Just to provide a little bit more insight for those of you who don't have this document handy, the indicators are looking at overall physical activity, sedentary behaviors, active transportation, organized sport participation, active play, physical fitness, family and peers, school, and then the community and built environment. For many of you, you may already be aware of this, but 4 of those indicators we have incomplete data for. So we really aren't even able to give a grade for many of those things because there's nothing in place currently for surveillance. And then for others, for example, active transportation grade was an F. And in our report card, it clearly outlines how the grades are determined based on the data that's available. And most of the grades are getting somewhere in the C or the average range. The best source of local data that we currently have is really the community health needs assessment that Children's Mercy conducts. That is repeated every 3 years. In fact, the hospital is working on the needs assessment right now. As that information is redone, we have been working to try to include additional information or questions in there that would help us gather some data for the indicators that currently have or that are currently incomplete. So yes, we're trying to do this report card somewhere around every 3 years after the hospital repeats its needs assessment. The other piece is the physical activity plan. And so that's what you just saw Rhonda share, the strategies for the different sectors. For those of you who aren't aware, we started this work a couple of years ago. We started with 6 sectors. They were schools, early childhood, infrastructure, parks and recreation, faith-based settings, and healthcare. This past year, we were able to start 2 additional sectors. Those are sport and mass media. In the spring of next year, we hope to be able to start an additional 2, which would be public health and business. We are currently trying to identify the best time to update the physical activity plan so that in addition to seeing the strategies that Rhonda just shared with early childhood, we would have additional information from the new strategies, the new sectors that have been added. And then again, we would update the physical activity plan once other sectors are brought on board as well. So our thought is at this point, we would probably update the plan every year or so as new sectors come on board. After we complete the strategies and priorities for each of the different sectors, we may not update the plan as regularly, but we could. It will sort of depend on whether or not the strategies identified would change. We feel like these strategies probably ought to be reviewed somewhere between every 3 to 5 years to make sure they're still relevant. What we will do, and we haven't decided the best way to do this yet because we're just starting it, is sharing information about implementation projects. So for example, as the early childhood sector begins implementing some of the strategies, and Rhonda just gave a great example, and it's providing the professional development. We want to try to share that as broadly as possible and then talk about the successes. So for example, I think this is the second time Dr. Kraft is going to be doing a professional development presentation sort of in our region. We want to make sure that people think that's valuable. If that is valuable and they really like having her come, how can we as different partners that participate in this work group, how can we help make sure more people hear about it, more people participate, more people implement some of the practices that she talks about in their EC settings. So I'm not quite sure the best way to do that, but that's what we hope is an outcome of the physical activity plan more broadly. So Kyle, that's a really long answer to sort of a short question that you asked, but I wanted to make sure that we talked about the variety of different areas that we're looking to provide updates. And then the other piece that I'll add here is we're also looking at how do we do this work across different sectors. So someone asked the Child Care Aware about do they support schools as well? Well, that's another sector. And so we do see a lot of alignment or potential across different sectors to work together to move some of these strategies forward in a more coordinated way. So an early child care program that's implemented in a school setting, you know, how can we make sure that both these sectors are working together to implement or advocate for those sorts of things that would make it easier to be physically active in both sectors, if that makes sense. Did that answer your question, Kyle?
Kind of, yeah. I mean, I would just, as we have these strategies and we work on implementation, I just wanted to know if there's certain things we needed to track, or if there are certain outcomes that we're wanting to stay on top of. And so that kind of answers that question. I mean, they're great strategies. If we have folks working across the board, it would be nice to know at some point, what impact are we having? You know, how did we address each of these as a community?
That's really good feedback, Kyle. And I think that something that comes to my mind when we think about, for instance, like strategy 6, thinking about the quality initiatives that are across the bi-state area and how many of them are measuring physical activity. I know there's a lot of quality initiatives that are utilizing the Go Knapsack, and that's something that we have been heavily supporting on both sides of the state. And so perhaps there's some data that we can include in a report. I like the idea of that, and that's something that we haven't talked about yet, but I think as a new person comes on board at weighing in, that is some discussion that we could definitely be able to start collecting. There's some great organizations like yours at Mark, the Family Conservancy, both Child Care Awares, that we would be able to pull some data. So thanks for planting that seed. Any other questions or feedback?
Well, the only other thing I'll add here, Kyle, if you have recommendations for how this work group can track actions that are occurring related to these strategies, we are certainly open to that. You're right, we do need to think about how do we communicate our impact, because if we can't do that, we're not going to be successful at engaging others and helping people understand the value of having a physical activity plan and these strategies in place. This is one of those areas that's been sort of challenging across all of the sectors. How do we demonstrate our impact, especially if the strategies are about sharing and promoting best practices? I'm just using that example because you just brought it up, Rhonda.
Yep.
How do we track that? And I'm not asking for an answer right now. I mean, unless you all have them, but we are asking ourselves that question too. And if you have recommendations for how we can do it, that would be great and very helpful.
Absolutely. Thank you for sharing that.
I see what you did there, Shelley.
She's pretty good at that, isn't she?
But that might be a good topic for this group. Maybe some
Yes.
brainstorming around some of this at a future meeting.
I agree. That kind of leads us into our next slide as we think about priorities for 2022. So, hey, we already have one identified. So I thought this would be just a good time to kind of talk about, what, as we think about those 4 strategies, what are some priorities that we want to focus on for 2022? I will share on behalf of Lori Lanter, who is the co-lead with me. She did bring up that at one time at the beginning, after we had identified our strategies and kind of during that process, we had talked about that there is such a wealth of resources in our region around best physical activity practices, that perhaps putting that together along with family engagement opportunities would be a great resource for the early care and education providers. Throughout, I would even say the last 5 years, there has been a wealth of support, especially in Wyandotte County, and also in Jackson County as well, just around quality initiatives around wellness policies. That is something, as Kyle mentioned around the data piece, I'm wondering if that is also something that we could tap into, because with the Family Conservancy, American Heart Association, there were years, and they continue to do that work that a Family Conservancy does around developing wellness policies. And I wonder if maybe that is something, as we move forward with that discussion around tracking and collecting and reporting data, if that's something to go back to those programs and look at, are you still implementing, your wellness policy that you identified around physical activity? So I think that there is a lot of information as far as resources back to that. And I did want to just share that something that Lori thought that we had talked about. And there's already so many resources. It's just putting it together. It's not creating it. So that is one thing she did want me to share with the group today. What are some other priorities, do you think? And think of, low-hanging fruit. What are some quick things that we could do? What are some more long-term? So looking at short-term and long-term priorities.
One of the things, if there's some way that we can focus and or partner with our city on having safe places for the kids to play. I mean, really, it's one thing to know it, but it's another thing to have a place to implement it. So either conversating with neighborhood associations or having conversations with our city. I was on a call last night with the police department, and I have a thing called Ring. If you listen to Ring, your nerves will be shot before the end of the day, and you would never let your kids go out.
Wow.
Or if you have Next Door. So how do we communicate that? So be preparing for spring, safe places, and why it's still okay to take our kids outside, and if not, where are some alternatives?
Excellent. Great. What are some other priorities that the group would like to focus on? Again, thinking back to best practices, standards, training, and family engagement. Those are kind of our 4 pockets, our 4 strategies or pieces of the pie, whatever analogy you want to use.
Do we know? I mean, last I heard, this licensing standards in both states were addressing physical activity and screen time and those things. Are there deficiencies in the current license? I mean, do we need to do an audit? Is there specific recommendations we need to be looking at? I mean, I'm really, honestly, I feel ignorant as to, are our licensing standards where they need to be? Do we need to be working on in both states on different standards around that strategy?
You bet. That is great, Kyle. I'm glad that you mentioned that. I think it would be worth our time, definitely, to do an audit of both the standards in the Missouri and Kansas side. I think, and it could have been 5+ years ago, I know there was a working group out of Topeka that a lot of the wellness technical support people were on. I remember Christy Smith was on that. And there was licensing from Kansas was on there as well. And I know that they did a side-by-side comparison looking at nutrition, physical activity, screen time, and infant feeding practices. So I like that you've identified that. And hopefully Lori could kind of give us an update too, maybe on our next meeting, if she's heard anything on the local and state level around that. Perfect. Anyone else? What are some other priorities? Thinking about your own organizations, is there any opportunity for training that early care and education providers could tap into? Also thinking about just professional development that is ongoing or yearly. I'm thinking of the lady that's here from the Olathe Head Start, thinking about their professional development and planning for their school year, thinking about, are those best practices shared in some form, either informally or formally with the teachers?
So we have meetings scheduled, I don't know, once a month for sure, to get everyone connected, and bi-monthly for just the teachers. So we have all of the family advocates that reach out to the parents all the time, and we have parent engagements. And so we definitely have opportunities for education for our families, to go to our parents and to go to the kids. And so I don't know, I'm still trying to get my feet wet on what all of this is about and how I can be of help. But we are definitely open to receiving any kind of education that someone can provide to us. We're always looking for someone to come in and educate our parents, our teachers, our advocates, our staff. So is that helpful?
Yes, that is. Thank you, Jill, so much. Yes, those are those great opportunities to think about, perhaps the resource binder that we would put together could really benefit programs, especially as you think about just what are the best practices. And those really have already been identified. It's just really sharing and getting that wealth of information out to programs. I think there's also a piece of it too that others on the group have said around, the need for technical assistance. So I think that's where we get an opportunity to kind of find out through organizations that are supporting early care and education programs, if that is some capacity that they have. And I know that Lisa Farmer has some capacity and the initiative that she's working on when you think about some of the technical assistance that could be provided around that resource.
Wonderful. We are always open to people coming in and helping us out.
Great. Thank you, Jill.
Thank you.
Any other priorities? No, we've got great resources on our call today that are participating. So I know that, these priorities that we're identifying, that we can put them to the test and we can move forward to implement them.
Wonderful.
Anyone else? Well, I think we definitely have some priorities that we've identified. Some are short-term, some are long-term. So I think we've got a good start, and we'll continue to visit these as we move forward into the next year. So what I thought at this time we could do is we could just go around, and if you have any updates from your organization that you would like to share with the larger group, this would be a great time to do that. So this is just kind of an open round robin. If you have any updates for us.
I'll go ahead and just jump in. Right now, it's good to sit in and hear, some of the, the discussion here, because right now I'm working on my 2022 plan of work, and it kind of helps me hone in on some of the. I like to. Last year, I only got one of them in, for a child care provider training. but it was well attended. Kyle, appreciate Kyle helping, push that out through the network. But this has helped give me some guidance and think of how I might plug in, because I think the move more, sit less training that we have to offer that's been approved in Missouri, that will go into the plan. And
Excellent. That sounds great. Denise, while you're giving your update, I was just going to ask, what has your role changed a little bit? Are you still working with the Go Knapsack?
I'm not officially on that, and I'm kind of, I love the tools and the resources, but I'm not officially on our state team.
Okay.
With that, and we're having conversations on how that looks for me going forward. That's part of the 2022 conversations.
Okay, great. Okay.
Great. I mean, it's like it was just some things changed, as a lot of things did, right?
Yes.
So, but yeah, I mean, I'm a big fan of the materials and trying to, do what I can, particularly with my new coverage area in Platte County that I have assumed. So not only do I have coverage in Jackson County, through some restructuring and reorganization, I now have coverage in Platte County as well.
Excellent.
So, yeah.
So Denise, I have a question for you. Has there been any discussion, and this would be open to anybody, on the Missouri side of getting the Go Knapsack modules approved for clock hours?
That has been on my list of questions being asked, and with I think that that's Jolynn is working on that, but again, don't have any update, but I think and hope, yeah.
Great, you've got it on your list. That's the first step, so that's great. Now that is another win that our partners at Child Care Aware of Kansas, they have got all the modules for Go Knapsack through Links to Quality. They have got all those modules approved. So Chris Nichols would be a great person if you're wanting to know how they did it. I know the systems are totally different. Perhaps would be a great conversation, but that would be Chris Nichols at Child Care Aware of Kansas. Any other organizational updates?
Well, Rhonda, I guess I'll just quickly, kind of fit into what Denise said. I too am planning for the next year. But just as a reminder, over COVID, we did quite a bit of online learning opportunities through our website. So you'll find a variety of recorded Zoom sessions that might be of interest to childcare providers and their parents. I know that there's one on there, the science behind family meals. So just a reminder of that. And then also, I've been trying to get some momentum going with our online dining with diabetes. So that went online this past year. So it is another option outside of the face-to-face. So
great.
Yeah.
Thank you, Lori, for sharing that.
Mm-hmm.
Well, I can also mention over here in the center of the state, I've been seeing a lot of concerns and issues with the child care providers. And I think I'm interested to see how the change in the recent legislation is going to affect some of that. But I think we have a huge opportunity to work with some food safety and sneak some nutrition in with a lot of our local ones. So one of the approaches that we are already kind of moving forward with is kind of back to urban community gardens. What we're finding is if you build it, they will come. So what's happening is we're having these little community gardens that we're working on developing. And sure enough, the kids from the housing units come out, a few parents, and they plant and they pick and they eat, at least the ones that are really focused on community engagement. So we're actually working with my MU counterparts here in this area to increase the community engagement piece, because we're kind of focused on some food desert tracts that unfortunately, and with Jefferson City, a lot of places in Missouri, but our topography makes nice 2-mile walks very difficult because they're so uphill and difficult to see. So it's not really it's not really safe to do that, especially when there's, you got to deal with some of the crime and things that are coming up in our neighborhoods, just like I think Ms. Cheen was talking about. So that's what we're doing here for now. I'm hoping to see, I know that's, I'm going to try to make sure this group is hooked up directly with some of the work they're doing at LU Extension with a lot of those community gardens and some of those other efforts, because they're really getting people out and moving, especially seniors that are taking care of kids, their grandparents as teachers and parents. So they're doing a lot with that, I think, in Kansas City area. So I'll have to try to get them hooked up a little more closely with you.
Great. Thank you, Sarah. Great work that's going on. Kyle, did you have an update?
Just that, we do training through the Educare program monthly for providers, and we've started doing some different training tracks, and I'd be interested in maybe doing an offering on health and physical nutrition and physical activity.
Great.
I know Denise mentioned a new training that they're doing. We might be interested in working with them again on that. And then we are also partnering through our collaboration with our Head Start program to maybe extend some of the services that Head Start offers through Swope Health and the Kcpa Health Care Clinic for dental services, the mobile dental clinic, to maybe some of our Educare providers starting in 2022. So we're excited about that. So we'll keep you up to date as that moves forward.
Great work going on. Anyone else want to give an update? Shelley, I wanted to know at this time if did you have an update on the position that was posted?
Yes, actually, this is breaking news as of last night. And literally last night, so I think I got notice at 5:30. We will have a new staff person starting after the beginning of the year.
Yay!
She just accepted last night. She has an MP, I think she has an MPH, and is currently wrapping up some projects with her current job. And with the holidays, just thought it made sense to start about the beginning of the year. We've not officially or formally announced who it is or anything like that yet. We're waiting on some paperwork and that sort of thing. And once we get that, we hope to be announcing that in December at the weighing in quarterly meeting and our monthly newsletter.
Great.
So we're super excited. I will say we still have one open position. And don't have any applicants for that at this time.
Okay.
So if anyone knows of anyone who might be interested, feel free to send them our way.
Shelley, what position is that?
The title of the position is a research assistant 2. Sounds kind of funny, and it's a change in position title from what Emily Meisen-Sebelius had. That is because of where we sit within Children's Mercy Hospital. We sit within the Center for Children's Healthy Lifestyles and Nutrition. So the responsibilities of what the person will do really haven't changed, but that the new position title aligns a little bit better with other positions within the center and allows for better career laddering. So we're really happy about that part. So don't let the research in the title, deter anyone. We're really looking for people with a variety of backgrounds. For example, I think if you don't know, my background is a dietitian. Emily's background, she was a social worker and had lots of experience from an advocacy and legislative perspective. Let's see, the other person who was in the position that transitioned out this year was an architect. We've had a school teacher or a former teacher in one of these positions before. And then the new person filling it has an MPH as her background. So, again, we're looking for a wide variety of backgrounds because we know that's important to provide a diverse insight into what we're doing and move these efforts forward.
What's the minimum education requirements for that, Shelley?
Minimum is bachelor's, although we encourage masters. I don't know. And I'll tell you, Sarah, that's a great question. Their background, meaning their education level, will impact their salary. So we want to be open because there are great candidates who have bachelor's degrees. We also, as at Children's Mercy broadly, have tuition reimbursement opportunities. So if there's somebody with a bachelor's that we feel like has really great experience and they want to pursue graduate degrees, that's an opportunity as well.
I got somebody I'm going to send you.
Excellent. Sarah, okay, so this is a great transition. Rhonda, if you don't mind, can I share my screen for just a minute?
Oh, of course, yes. There you go.
Okay, I wanted to make sure, can you see my screen now?
Not yet.
Oh, hold on. Nope, sorry. I gotta do one more thing. Okay, how about now?
Yeah.
Do you see the November Early Childhood Working Group meeting?
Yes.
Excellent. I wanted to make sure that everyone in this group knows that after each of these meetings, we send really what we hope to be a monthly communication targeting each of our different sectors. We send this in addition to a broader weighing in newsletter that has a little bit more, I'll say a broader appeal. But if you haven't seen this come through your inbox, it could be going to junk mail. You just have to make it an approved sender through your, for your companies or organizations. I don't even know the right term, but approval list to have it show up in your inbox. But what we try to do specifically for early childhood is send information about the upcoming meeting, how to register. This is a little bit different change from what you guys have been doing in the past. What we've noticed, especially with both of the other team members resigning this year, it was challenging to step in and learn how each of the different sectors were managing their communications. So what we decided as a group was we want to streamline this and do the same thing for each of the different sectors. So this is going to result in a tiny change for you all. The Zoom link is going to be different. So it's not going to be the same ongoing Zoom link that we've used in the past. We are going to ask that everybody register for the meeting. What we found is that makes it a little bit easier for people to add the information to their own calendars with the Zoom link included in that meeting invitation. I'm not going to click here just because my computer is running slow this morning, but if you clicked here to register, it takes you to an Evite. And in that Evite, you can register or RSVP for the meeting and then add the meeting to your calendar. So I just wanted to point that out as a change in how we've been doing things with the Early Childhood Working Group. Then the other thing that we're trying to do is include information and resources that you all share with us, whether it's through this meeting, or you can always send that information directly to us at Weighing In, either to me, summer@cmh.edu, or the Weighing In email, weighingin@cmh.edu, for us to include in our distribution lists. We can include it specifically to the early childhood group or a little bit more broadly in our monthly newsletter. So in here, you can see the upcoming training, which I'm happy to include. This is the past one. So this is actually a webinar that was hosted in October with the Partnership for Healthier America and Early Childhood Educators that we thought you all might be interested in. We found out about it from somebody within the center and thought, again, because it's targeting early care and education centers, we'd share it with this group. we're trying to help you all promote other activities, that are going on, and then reminders about the strategies related to the physical activity plan. So if you have any trainings or things that resources, opportunities that you want us to include, again, please feel free to do that. That's how we're trying to align with these strategies and tactics to promote either high priority best practices or trainings that are going on, etc. So I'm going to pause for just a second and see if any of you have any questions about how we're doing this, or the new process.
Thanks for that explanation, Shelley. I appreciate that.
Yeah, you bet. We know it's probably been a little bit confusing, and with that transition, I think most of you know, I've been a team of one until recently, and I want to thank Evelyn, who has helped provide quite a bit of support for this and sort of train me on all of these different pieces. And then we're thrilled to have Veronica, who just joined our team at the end of October, and then we're really looking forward to a new member joining in January. So we appreciate you bearing with us through these changes. I know it's been a little bumpy, but we're getting back on track. Okay, great. I'll stop sharing then. And just wanted to point out that little change, and then you guys can let us know what else you think you'd like us to include in the upcoming newsletter that we'll send out after this meeting.
Great, thank you, Shelley. So in closing, wanted to just ask a little bit of feedback. Would we like to do an earlier meeting in December, or skip it and start fresh in January 2022? Any opinions on that?
I will offer.
Oh, go ahead.
Yeah, I'll offer one consideration, and I should have mentioned this just a second ago, but the next weighing in quarterly meeting will be on Thursday, December 9th from 9 to 11. I think all of you have participated in weighing in quarterly meetings before. I will offer that we could have a breakout session at the very end of the meeting for you all to touch base, if you think that makes sense and that date is a good date for you when you're already planning to attend the weighing in quarterly meeting. I will also say the presenter for that meeting is Kai-Ling Kong. She is a relatively new researcher at the center, and her area of interest is obesity in infancy and the prevention of childhood obesity. So she's going to be talking about her research related to infants and infant feeding practices. So that's the topic for that day.
Great. I think that sounds good.
Invitation gone out? Because I don't see anything on my calendar.
In every monthly weighing in newsletter that we send out, we do include the date for the next weighing in quarterly meeting. The next newsletter is going to go out on Monday, and in that newsletter, we will now have the title and the name of the presenter. The registration link will be in there as well. So you haven't seen it this month, and you may have missed it last month because we didn't actually have a title or the presenter.
Yeah, I think that's probably what happened, and just I had some weird email issues there for a couple weeks, things syncing up and questions answered wrong. Yeah.
Oh, goodness. Yeah, if everybody is okay with that, I'd love to take Shelley's offer to have a breakout group at the quarterly weighing in meeting on the 9th. We can just kind of touch base, would be great. Any objections to that? If you're able to join, that would be great. Okay, I think we'll go ahead and do that. The last thing too before closing, so in December, look for a little survey to come to you. We just want to, as we move forward with 2022, just looking at making sure that this meeting time still works well with the group, the morning time frame, the fourth Thursday of the month. And then also in that survey, we would ask, is there anyone missing from the group that you think should be here that is not currently here? And if you could list their name and their contact in that survey, that would be really helpful so that we can continue to grow our working group. Great. Any last questions or comments before we end? And I can give you back 5 minutes.
Thanks for having the meeting today. I'm looking forward to getting to know more about this organization and how we can work together.
Great. It was great to have you, Jill.
Thank you.
All right, then we'll go ahead and close, and everyone have a great weekend, and thank you so much for your time. We'll see you on December 9th.
Thanks, everyone.
Thank you.
Thank you.
Thank you.
Oh.